Hi, I'm Dr. Mark Schusterman, founder and senior surgeon of Museum District Aesthetic Plastic Surgery. Today we're going to talk about breast reconstruction, specifically microsurgical breast reconstruction. I performed the first microsurgical breast reconstruction in Houston while I was at the University of Texas MD Anderson Cancer Center. At that time, there were few people in the world performing this procedure. I developed the techniques that are now being used not only at MD Anderson but around the world. It's popular because you use a patient's own tissue, specifically the tissue that's in a woman in her lower abdomen that usually gets discarded in a tummy tuck. So yes, you get a tummy tuck at the same time as you get a new breast. Obviously, many women find this very attractive. The tissue itself needs to be transferred on its own blood supply or maintain its own blood supply. To do that, we need to use blood vessels that come through the muscle in the abdomen, the six-pack muscle that is technically called the rectus abdominis muscle. And this muscle has two blood supplies, one from above and one from below. By using the lower blood supply, we can minimize the amount of muscle taken. In fact, we can perform the procedure without taking any muscle. This is technically called a perforator flap because we're simply using a perforator vessel that comes through the muscle up into the skin and fat to provide blood supply to this tissue. By performing this procedure, we not only are able to transfer the tissue with a good blood supply, but also limit the amount of abdominal wall interference. This is called a deep inferior epigastric perforator flap, or DEEP flap. And it's similar to a free tram flap, the only difference being the amount of muscle taken.